Diabetes and COVID-19 webinar series. Thank you for joining us, and I imagine a few of us will be joining in the next hour. Let me introduce myself. I'm Khalida Ismail. I'm a consultant diabetes psychiatrist based at King's Health Partners, which covers a few NHS trusts, King's College Hospital, Guy's and St Thomas's Hospital, and the South London Maudsley Trust, as well as the University King's College London. Before we carry on, I'd just like to do a little bit of housekeeping. Can I remind you, please, to turn your mics and your video function off? You will definitely hear us better in that way. And also, just want to invite you to send questions and comments via the chat function. So please get your thinking hats on, because actually we really do want to hear from you. We may not have time to answer all the questions, but we will be reading them and it will be informing our future topics. So I'm now going to also be welcoming you to our team. I'd like to welcome you to Josh Salter. Josh, hello.
Hello.
Hi. And Dulmini Kariyawasam.
Hello.
And then Rebecca Upsher.
Hi.
And Emma.
Hello from me as well.
Hi. So just to give you an overview of the sessions, the purpose of these sessions is to provide an online interactive live forum or a space for people with diabetes from all walks of life and all types of diabetes to share their thoughts and feelings, especially during the COVID-19 pandemic. But it's also to share a toolkit with you, which we specially developed, made for you of ideas of how you can help yourselves and your loved ones. And each week there'll be a different list of ideas and strategies. We are also here to listen to you, share your experiences with the wider diabetes community, and thinking with you so we can develop better ways of coping. These sessions will not be providing any specific clinical advice. If you do need any urgent medical or mental health care, please contact your GP surgery, who will listen to your concerns and try to help you. So the format of these sessions is that we will first be interviewing the person with diabetes, followed by a healthcare professional for about 10 minutes each. During that time, we'd like you to listen, but also be thinking about your questions and ideas and views in the chat function. Emma and Rebecca will then be reading those out, and we'll be discussing them with you and with our interviewees. Please do not worry again if we've not read your question. We have actually read it, and we will be collecting all the questions and summarising them on our Twitter page at KCLDPsych, which is KCLDPSYCH. Also, sorry to remind again, don't forget to stay mute, otherwise we'll be hearing all sorts about you that maybe you don't want us to. So I'd like to welcome again Josh Salter. Thank you so much, Josh, for joining us. Perhaps you could tell us a little bit about yourself and why you're here today.
Hello, everyone. My name's Josh. I'm 24. I was diagnosed with diabetes when I was 6. Released from hospital December 24th, 2001. That's quite fun. And I met Emma through a friend of a friend. And with Emma, I started a support group for young adults with type 1 diabetes in my area, because we found there wasn't any structure for young adults with diabetes, and often young adults have more not complicated, but more kind of topics about diabetes they don't really want to discuss with other people, you know, psychological issues, potentially addiction issues, anxiety issues, these sort of things.
All right, thank you. Josh, you said something that I don't think you meant really, which is that I think you got your, when you said 2004, you mean you were diagnosed with type 1 diabetes age 6. Is that right?
Yeah, sorry, yeah. So type 2001 was when I was diagnosed.
And then you were 6 years, and you used the word fun, but the way you used it, you didn't really mean that.
No, of course I didn't. I was using it sarcastically.
Yeah, so tell us a bit, if you're able to and willing, would you tell us a little bit about what your experience was of being diagnosed with type 1 diabetes?
Well, like I'm sure most people who were diagnosed at that kind of age, I didn't really understand what was going on. I was obviously very young and I didn't really grasp it. I know it affected my family. I know my mum and dad were naturally quite worried, and yeah, and there was a lot of kind of me as I grew up coming to terms with it and understanding more about it, and going from a place where it perhaps has to be something your parents control for you to something you have to control yourself.
So when did you first realise you actually had diabetes?
It wouldn't have been that much later. It probably would have been about 2002, I would have said. Late 2002, early 2003.
And what would be your first memory of that?
Well, genuinely, my first memory, this is sort of a slightly funny story. I was on a holiday with my whole family, and I wanted to go downstairs to have breakfast with my sister, but my mum and dad were still asleep and they wouldn't give me my injection. So eventually I just went sod it and I injected myself for the first time with the correct dosage. My dad dosed me up, injected it, and then went downstairs and had breakfast with my sister. And then ever since then, I sort of started being more interested, because then it gave me more freedom.
Yeah, that's pretty impressive, actually, isn't it? Sort of taking charge at quite a young age. But what about, that's a really good sort of example, memory of a practical aspect of being aware that you've got diabetes. Well, what about emotionally? When did you start having thoughts and feelings about diabetes, that you've got this condition?
I don't know really. It's kind of as I've mentioned before to Emma and other people. I had a lot of other sort of emotional things going on in my life at that time. I suppose when it first started to really drain on me emotionally was probably around 11, 12, that kind of age, when you're moving from primary school to secondary school. Those were some quite those are some quite unpleasant years.
Are you able to tell us a
elaborate?
Bit about, yeah,
of course. So I found most of my experience with diabetes, especially when it comes to schooling, was that the sort of the lower tiered people, like your teachers, would trust me more to know what I'm doing, whereas the higher tier people, like say the head teachers or the district nurses, because they thought they knew it all, they wouldn't trust me doing anything. So they would often restrict things I could have, or if you're having a hypo at age 12, normally what you'd have is you have a juice carton, maybe a couple biscuits, but they were very anti kind of all that, because it was considered junk food. So they'd only give me very bizarre things to eat, which didn't help. I know that we had a lot of judgment from a lot of other people, like other parents or other faculty workers, assuming that my poor control as a child was solely due to family negligence or my negligence, rather than it being something that is a very difficult thing to manage.
Did people actually use those words?
Yeah. We had a long, hard-fought struggle with some diabetic nurses who thankfully aren't diabetic nurses anymore. They were disbarred, as they were, and some other higher officials from school districts and stuff who I had to have many a meeting with, because they just didn't understand that a child, someone going through puberty and going through diabetes and having other, as I'm sure everyone does, emotional issues and stress going on in your life, it makes controlling diabetes quite difficult.
You mentioned other emotional stresses in your life.
Well, you've got all the standard things about, like, when you're growing up as a teenager, you've got self-confidence issues, anxiety. I've got my father passed away when I was 7, so that was quite a sort of, that was a whole blow to my whole family, and that's kind of that kind of affected my mood.
Is now joining.
That affected my mood, therefore my diabetes was affected, and it kind of this weird sort of cycle.
I mean, those are really very powerful, we call it in our trade life events. You had two major sad life events at a very early age in your life, 6 and 7, very, very close to each other. You getting diabetes, that is losing a bit of yourself, isn't it? You've lost something of your body, you lost a bit of your pancreas working properly, and then a year later your father dies. It must have been a very tumultuous time for you. And what you're saying is that nobody really picked that up in your teenage years and at school, and instead what seemed to happen is that the system blamed you and your mother, who must have been a single parent by now.
Yeah, it was very much a case of and I'm sure like maybe people listening, but I'm sure everyone knows, it was very much a kind of situation where it was much more of a blame game rather than a game where people say, well, what can we do to help?
Yes, and I think that's a really, that is often the current theme. I'd be really interested in what the audience says in the chat function about the blame game, that somehow if your diabetes isn't going well, it is all your fault.
Please hold.
All of you, and why you might be struggling with it. And I'm sure you are as well, be interested in finding out if other people have had a similar experience, and also how health professionals approach this problem in clinical practice as well. So thank you for that. And to tell me, can you tell us a little bit more about schooling? I mean, were you in a way, you were sort of almost a bit bullied by the officials, weren't you, by some of the officials? But what about your peers?
Genuinely, most of my peers were quite all right. I was very lucky to have a very close group of friends that I'm still friends with from school. And sometimes they get it wrong, like I'm sure they do. Sometimes you say I'm having a low blood sugar and they'll get you a Diet Coke, which is quite, it's difficult, but they mean well. A lot of the sort of a lot of my extended peers, so people you sort of knew from school but weren't really close with, they knew I had diabetes, and sometimes they were interested and asked the standard questions you might always all diabetics get asked, like, well, can you do this? Can you eat that? Should you be doing this? Should you be doing that? But luckily, I never actually got any negative like direct negative feedback from my peers. I was never bullied for being different that way. I was bullied for lots of other reasons, but never for being diabetic.
Yeah. Okay, but have you heard of other young people being bullied for having diabetes?
I have once. I spent a couple of weeks in Royal College Hospital, London, for some testing with a bunch of other type 1 diabetics, and I met a young man there who was a couple of years younger than me at the time. I think he was 13, 14, and he was living in the middle of London, and he got bullied quite constantly by his peers just for being different.
Yeah, I'd be again, interested in finding out if other people with diabetes report and describe bullying at school and what form it takes. And I think you say it quite succinctly, is that even though you don't look different, you are, people perceive you as different because you've got diabetes, probably because you've got to have, like I've had people who've said I was put forward at the front of the dinner queue rather than be like everybody else, or I was given an extra biscuit at tea time when all the other children didn't get an extra biscuit at tea time, at snack time. So there's all sorts of little subtle things that happen, aren't there, that sort of separate you. I just noticed that my screen's just going, so I'm just going to put that back up again. What I wanted to also ask you is, you mentioned that people often ask you about your diabetes, like how's it going and so on. What's been your sort of like, what do you find are the sort of useful questions that peers and friends and strangers ask, and perhaps the not so useful questions?
The useful questions, in general, I find that most people who ask even the sort of annoying or patronising questions, I find they do actually mean it from a place of care and love. They do actually care, they just don't know what they're talking about, which can be quite frustrating for us. The good questions I've been asked are things like just general ones like, oh, how are you doing? How's your blood sugar? Like how is it? Not like the matter is just asking. Or things like, oh, if you're having a hypo and you can't, like, you need help, what can I do?
Wow.
Or if I say I'm having a high blood sugar, I'm going into hypoglycemia, and they say, what can I do? that kind of thing's quite helpful. Some of the not so helpful questions, obviously, are should you be eating that? Are you allowed to eat that? Shouldn't you be drinking this? Should you not be drinking that? Yeah, just the standard other people judging what you are doing, even though they have very little knowledge about the condition that you have.
It sounds like but it's really, there's great, actually. There's the really good examples of how friends and family can actually be very supportive in a very simple way by just asking that very simple question of how are you doing? How's your diabetes? You know, without really asking what the value is of a blood sugar, but actually just checking in on you in that way. And that's very sort of open-ended, non-judgmental. But the other ones, which I think are judgmental and sort of quite sort of
is like now joining
about how you know, I've heard that so many times as well, which is, should you be eating this? You know, are you allowed that? Isn't that sugar? And I was interested in finding out how you respond to that.
Well, sometimes it depends who's asking. I find if it's someone I know who is genuinely cares or interested or is coming from a real place of concern, then I might say, oh yeah, it's fine, and then explain to them why. Or if it's just someone just making a like an off comment, or someone's just sort of asking but they don't really care about the answer, normally I'll just sort of say yes, and that's it, because they're not going to ask a follow-up question. If someone asks you, should you be having the ice cream, you just look at them and go, yes.
I love that. I think that's great. I think if a lot of people with diabetes had that sort of assertiveness, I think they'd feel a lot. People who find it, I think a lot of people with diabetes, especially young people, don't quite know always how to answer that question because they feel that they're being judged or criticised, or they're being bad in some way. And I love your reply, which goes yes, and then that's it. It's full stop. Move on. So that's a really, really helpful tip, I think, Josh. So thank you for that. How has sort of the COVID-19 epidemic affected you psychologically from the diabetes perspective?
Two very quick things. I wanted to just quickly going back to the people asking questions. Sometimes I feel it's important for people to understand that sometimes the questions that aren't asked hurt the most. The amount of times that I used to go around people's houses to have dinner, and I wouldn't get offered something just straight off the bat because they knew I was diabetic. And it's very difficult for you to suddenly be like, well, can I please have some cake? That's something I think needs to be sort of dealt with. As for COVID-19, prescriptions have been difficult to get, to be honest. Luckily, I've got friends who are willing to risk themselves because they're healthier. They'll go and pick it up for me, and then I'll go meet them at a 2-meter distance, and they'll sort of put it down, and I'll pick it up off. The isolation is difficult. I'm a very sociable person. I've got a lot of peers I like seeing. I'm sure, like everyone else here, not being able to go and just hug your friends and doing that normal day-to-day stuff is quite difficult, but I suppose that affects everybody, not just us diabetics. I have noticed, sorry, go on.
It's interesting, you're dividing it into two parts, aren't you? One is that there are things that you're experiencing psychologically from COVID-19 that everybody is, which is, I'm not able to see my friends. But you're also describing something very specific about the fact with diabetes that your prescriptions are harder to get hold of. You've had to elicit support from your friends and family to collect them for you and create various maneuvers to get hold of it in a safe way. And that must be quite stressful, isn't it? Having to turn to people, something that you just did with your eyes closed, you're having to turn to people and you're a bit more dependent on others.
It is true. However, I mean, for me personally, anyway, I'm very much of the mindset that even the strongest people in the world need help sometimes, and I'm lucky to have people who can help me. So I'm not abashed to ask for help, and they're happy to help me out during this time because they know. Likewise, if they need my help for any other reason, I'd help them. And there are small perks to the being diabetic, because I'm sure, like most people, listening who are diabetic, we're completely normal. Like we're normal, except the fact that we've got a little bit of extra good, like a little bit extra spice in our life, which gives us some perks. Like for instance, some of the big food suppliers will now deliver to your door, but only if you're vulnerable. And diabetics fall into that category, so we can get food delivered to us if we don't want to leave the house, which is quite nice. So there are pros and cons to it, really, in this situation.
Well, I guess what you're saying from that point of view is that you feel that as a society that people with diabetes who are perhaps fall into that vulnerable group are getting some support at an organisational level, and appreciate that.
Yeah, I do from a private business support level. I haven't had any support from any of my diabetes team or my sort of healthcare professionals as of yet. I think I got one text maybe saying, "Oh, if you need any help, give us a call." But apart from that,
okay.
I found that the private sector has been more supportive of people who with vulnerabilities than the public sector. But that's just my personal experience. So I'm sure it varies wildly from county to county and from place to place.
Yeah. Well, let's find out on the chat function what other people with diabetes, what their experiences of the support they've had from the diabetes NHS, as it were. Just aware that our time is moving on, and I wanted to ask you that you mentioned that you set up this support group where you live, and it's just really amazing that you did. It's and it's fantastic. As congratulations, and you're very active, and you get to know a lot of people. What are you hearing from other people living with diabetes about their concerns in the context of COVID-19? What are the other people finding difficult? Because you come across as a little bit more, you come across as quite a strong personality,
Thank you.
Especially when you told me about the thing about your dad, it was asleep and you actually just sorted out the insulin yourself. That was really impressive. And you must have only been 6.5 at that time. So I've got an idea of how resilient you are, but maybe other people aren't so resilient.
Well, I know that some of the members in my diabetes group that I run with Emma, I know that a lot of them, some of them are especially struggling with the isolation, which I'm sure everyone is. But then it also massively affects their blood sugars, and people I know who naturally run a bit higher anyway, say 10, 11, 12, are now running at 15, 16, 17 because they're just sort of the emotions that are draining on them. Are draining on them more than usual, which is perfectly understandable. And I know that, like as you say, not other people might not have the friends or family to help them out as willingly as mine are, or some might not be as willing to ask for help because of personal reasons, which I completely understand. I used to realise the same. And one of our members, she's found it really difficult to get prescriptions and even just get basic insulin because she's fearful because she doesn't want to go out and catch it because she's worried that she might become seriously ill. But on the same time, she doesn't want to ask. She doesn't have the right people to ask for help, or doesn't want to ask for help because she feels weak in some way.
Yeah.
I mean, I don't think like that anymore, but I used to, and I completely get what people do because it's a very, very, very difficult thing to ask for people for help.
Yeah, exactly, and I think you've hit the nail on the head. I think what you're trying to say is that there are some people who perhaps might already have a little bit of issue of confidence of looking after their diabetes as well as they could be. They're the ones that are probably struggling more than those that are generally a little bit more confident, isn't it? You're saying that these are the people, some of your peers with diabetes who always run their sugars a little bit high are really struggling with it, and it's really activating feelings of insecurity, isn't it? How do I actually ask for help? So I think that's a really important point, and I think your message is just ask, isn't it? Your take-home message is sort of just ask for help, and you'll be surprised that actually your friends and family might really be keen to support. Very much so.
I mean, I'd like to clarify, by no means is my control good. At the moment, I've been hitting low blood sugars like more than anything. But by all means, yeah, I wouldn't be where I am today. And I personally don't think as I've mentioned, I've struggled a lot in my life with not just diabetes, but other mental health issues. And I wouldn't think I would be where I am today if I didn't ask for help when I really needed it. And I think now is a time when everybody, not just diabetics, but everyone really needs to ask for help from other people, whether it be emotional support, just helping out with your diabetes like prescriptions, or just calling a friend to see how they're going, because we all need help and we won't be in our own life without it.
Thank you, Josh. That's a really, really lovely take-home message of asking for help rather than ignoring it. So I'm now going to move on to Dr. Dulmini Kariyawasam. Thank you, Dulmini, for joining us and for being patient. I know you were busy with ward rounds and so on at Guy's this morning. Can you tell us a little bit about yourself? Like, you know, where did you study medicine? How long have you been a doctor? And what made you decide to become a diabetes doctor? Can't hear you. You're still on mute.
That's fine. So I'll start with the last question, Khalida. Why I decided to be a diabetes doctor. I sort of, listening to Josh, I thought that's exactly why I wanted to become a diabetes doctor. So a bit about me. I studied medicine in Sri Lanka, in Colombo, and then I came over here and did all my training, junior doctor training in London. And I became a consultant in diabetes and endocrinology at Guy's and St. Thomas's Hospital. It'll be 10 years next month. So that's how long I've been a diabetes consultant for.
But was there a turning point where you said, that's it, I'm going to become a diabetologist?
So I think I'd be lying if I said I knew from the beginning that I wanted to be a diabetes doctor. As a junior doctor, you go through different specialties, but I think the point where I decided I wanted to be a diabetes or endocrine doctor was when I was a SHO. I did an attachment for about 6 months actually in Surrey in St. Peter's Hospital, where I did a 4-6 months diabetes. And why I liked it was because, you know, that continuity, being able to get to know patients, getting to know patients more than their just the diabetes or the medical thing, knowing about their social things, you know, I that was quite appealing to me, that long-term continuity of care. And sort of, as I say to my young people now, I'm sort of getting older with them. I'm seeing them when they're 14 now. Some of them are having kids and, you know, jobs. So that with more than just the medicine, that is quite rewarding. So that's I think that's one of the main reasons.
What you're saying is, isn't it, that the nice thing about working in diabetes is that it's not just a disease that you're working with. You have to work with a person.
With people, it's a person. Yeah, it's a lot more than just the disease. And I think if you want to be a good diabetes doctor, just as Josh said, I totally understand. I can empathize with him. It's not just about looking at the numbers and saying, oh, this is your blood sugars, this is your HbA1c, but being genuinely interested and curious about that person as a person, you know, what is happening in their life and what are their other struggles. So that bit really interests me, and that's something sometimes in some other specialties you don't get. You see the patient, you know, you treat whatever they have, and you're never going to see that patient. So I think we're lucky that way in the field that we're working in.
And I imagine because of, you know, your work in the, would you say that is your area of interest, the working in the young people, or do you have any other?
So my special interest is working with young people and teenagers. So I'm the lead for the transition and young adult services at Guy's and St. Thomas's. So I work closely with our pediatric colleagues and do joint clinics. I would start seeing patients when they're about 14, 15. So I sort of, you know, Josh was speaking about how difficult it is going through puberty and with all the other life changes that goes through being a teenager. So my interest is actually looking after young people.
Great. And have you been actually developing that project, that service? I mean,
sorry, Khalida, I couldn't hear you clearly.
What innovations have you developed?
So we have one of the biggest young person services in London. So the main changes we have done, I mean, the model we work clinically has changed significantly over the last year or so. We're doing a lot more. So one of the problems that we have is during the time of transition, how patients don't get joined up care. They've got used to their pediatric team, and then they're suddenly transferred to an adult team. So we've tried to avoid that and develop some sort of a very seamless transition where we work very closely with the pediatric teams. And we the other main thing we have done is we developed a project called the YES project. So YES stands for Youth Empowerment Skills. Now the name, it's quite interesting. The name was chosen by young people themselves. So that reflects some of the things that Josh was talking about, because the two things they told us when we wanted them to come up with a name, they said, we don't want the name term type 1 diabetes in the name, and we don't want education in the name. So they said youth empowerment skills. So the whole idea of the project was empowering young people to look after themselves, to build confidence, being able to talk to other people or even strangers about diabetes, you know, what their problems are. So what we have done is develop this program together with young people. So it wasn't something that was developed by healthcare professionals. We got together with young people to understand what their needs are. One of the key messages that came out was, it's not just teaching us about diabetes, but teach us how to live a normal life with diabetes. You know, we have other problems. We have problems with relationships, the girlfriends, the alcohol and the drugs. We need to learn about all these things. We don't want doctors talking to us about how to do injections, how to take blood, you know, what the normal blood sugars are. We want some help with being a teenager. So that's what YES is all about. Another core component, I suppose, is providing peer support. So we get about teenagers of the same age and give them the chance to speak just about what's going on and what problems they have, what's positive or what struggles they're having. The feedback has been really good. It's actually, we started it at Guy's and St. Thomas's. Now it's been delivered in whole of South London. Right. And with the Type 1 network, we're trying to extend it to be a pan-London wide program. So anybody from London could come and do this program.
Wow, so that's fantastic. That's really fantastic, isn't it? From a sort of small idea that you developed with people with diabetes, young people, it's become a sort of pan-London one. And I imagine there might be some questions from the audience who aren't from London saying, excuse me, what about us? You know, is this a bit of postcode lottery?
So one thing good about this program, I suppose, is there's a structured curriculum and there's a way we can train other healthcare professionals. So if anybody wants or anybody is interested in knowing about YES or want to deliver it, we have a training package so we can train other healthcare professionals, and you just need to have a discussion with your commissioners as to how to fund it. And our commissioners in Lambeth, Southwark and the South London commissioners have agreed to fund it as part of structured education for young people with type 1 diabetes.
Okay, so that's great news for those health professionals who might be listening in who aren't from London about it. Can I just go back to the original sort of concept of these webinars, which is COVID-19? How has that affected your work as a diabetes doctor, especially when you think about what new roles you've had to take and how you think that's affecting your patients?
So how it's affected me, we have had to stop doing all face-to-face clinical appointments. Having said that, I want to emphasize this. If somebody needs face-to-face care, we are still open. So if somebody is not well and they have to really see somebody, we still have clinics that we can see patients. But routinely, we have stopped seeing patients face-to-face. But what we have done is we've been converting all our appointments to virtual appointments. So at the moment, we are doing telephone appointments as we would normally do. And especially in the young persons clinic, we used to do virtual appointments even before COVID. So we wanted to support young people because the kids who are doing GCSEs or A-levels. So we didn't want them to miss school to come to a clinic every month or so. So what we have been doing is we've been doing download clinics where patients download their meters from home and send us an email to say these are the problems, and we would write to them back or telephone them at a later time, sort of 5 to 7, so that they don't need to miss school. So we've we've sort of had a system even before COVID, and it has become sort of really helpful. So that's just in the young persons clinic, but even the wider diabetes clinic, we've changed our clinics to run virtual clinics. So technology is advantage because we can see patients' data from, for me, sitting at home or in the hospital. So we're trying to provide as much support as possible virtually, and especially this is a psychology session. So even psychology support, we have been doing virtual clinics for our young people.
Right. Okay. So basically what you're saying is that you were already a bit one step ahead. So it was quite relatively easy. But what do you must be missing your patients?
I do miss my patients. I do. And it's really sweet because when I speak to them, it's quite nice how Josh was saying you don't need to be ashamed to ask for help. And I've changed as well. I've asked my neighbors to do my shopping sometimes, which I would never think of doing. And it's quite heartwarming every time I speak to a patient. It sounds as if they're more concerned of me than of them. Are you okay, doctor? Are you keeping safe? So it's and I do miss seeing patients. I do miss not being able to do our group work because we used to do a lot of peer support group work, and we were planning to do a year's group during Easter holidays, and we had to cancel that. So we are missing being able to do face-to-face work, but we're trying as much as possible to keep things going virtually.
I think you've said really powerful, really, which is saying that a lot of your patients are saying to you, how are you? Are you coping? Because they know you're working in the NHS, you're on the front line. They're probably more exposed to getting the infection than they are in a way because they're perhaps isolating. And I think what you're really emphasizing is how important the relationship between your diabetes clinician and you, the person with diabetes, is so important. It's not the blood sugars, it's not the HbA1c, it's not how much insulin you've given, but the quality of that relationship is really important. And I think you've managed that in the young person's clinic. And Josh, it'd be interesting to see if Josh feels the same, and whether other people with diabetes in the chat group who are listening feel that they've got good relationships with their diabetes professionals, because without that, you can't do the work. So I think that's really powerful what you've said, and thank you for that. What have you been noticing in your conversations with patients, apart from them worrying about you? What have you noticed about their own worries and concerns, and how are your team supporting them through their psychological needs?
So some of the main worries are, especially for young people, as quite rightly Josh said, that isolation, being stuck at home, sometimes with parents, parents are not the people, teenagers would want to share how they're feeling, or so that's become a problem. So we're trying to come up with, because we were doing these peer support groups, what we're trying to do now is try and see whether we can do something like this, what you're doing. Get our young people virtually and give them the opportunity to have that peer support, and once a week to have a 1 hour group session. So we're just trying to pilot it. We'll have to see how it goes. Their main worries are with things like quite relevant to what Josh said, how do they get their prescriptions? A lot of people who were on insulin pumps, or warranties were running out, were worried what's going to happen. But the most important thing is, I suppose, having that communication going. If they have a question, how do they reach out to the healthcare professionals so that we can clarify information? So I think that's really important. If you cut that connection completely, then I think the patient's anxiety will be even higher. But whereas if they have a worry, if they have a question, if they can get back to your healthcare professional that know you really well, I think then those worries are less. And what other concerns do they have? They do worry about when they would be able to come and see us face to face to get a proper review, have the blood test. So those worries are there. There were some concerns from some of the young people at the initial stage before the full lockdown. Should they go to work? Should they not? Would diabetes patients be part of the shielding? I mean, that's become less of a concern now because there are specific diabetes-specific guidelines. So those are the main concerns, I would say.
I think what I really appreciated in what you said was that you've got all of these in mind, as a diabetes team, you and your colleagues are aware that people in your clinic are worried about these things, that you're trying to be proactive. You know, you're saying having open communication channels, let them say, I'm struggling with this, I'm concerned about that, and trying to help them solve the problem. So, you know, I think what the message is that you are aware that people with diabetes are worried and that you've got that in mind. And I think that's really important. So we're going to just stop there for a second and just open it up to the our wonderful listeners and go through some of the questions that you've been asking. Rebecca, did you want to start out with some of the questions?
Hi, sure. Can you hear me okay?
Yes.
Great. The first one is more of a comment. I hope that Josh can see the lovely messages coming through on the chat and saying thank you for sharing your experience. One says, you've made me think a lot about the complex issues around stigma, support, friendship and survival. So I think that also reflects our gratitude as well for, you know, you coming on and sharing your experiences. So thanks, Josh. One question that came in was around prescriptions, actually. So someone had been asking their neighbour to collect their prescriptions, but then sort of hated asking for help and ended up going to collect the prescription themselves. So the question is this advisable?
Yeah. So actually, Dulmini, as our diabetes colleague, we're not providing clinical advice, but just a sort of an indication of what you would, you know, what you think about that and what you would suggest.
Sorry, you're still on mute, Dulmini.
I think the safest would be for now to get somebody to collect your prescriptions, or get some pharmacists do home delivery. So as much as possible, at least for the next couple of weeks until the infection rate goes down, it would be better if they didn't have to go out and collect their own prescriptions.
Could I just add, because this is the psychology webinar, is that perhaps that person and maybe other people in the audience, the idea of asking for help, you know, it's a really, really good question because it activates your self-esteem. Are you worth it? Is somebody really going to care about me? And I think Josh described that he went through that period where he avoided asking for help because it would be humiliating. And I think that if you can think about what emotions it's bringing in you, that this will humiliate me, that person may refuse, I maybe be a burden on that person. Think about that, but also then say, well, actually, you don't know what that person is really thinking. When you ask somebody for help, you can't read that person's mind. So if you're sitting there thinking, I really want to ask a friend to help me get my prescription, and then immediately you say, oh, but this is too embarrassing. My friend might say no, my friend might think of me as a burden. What you need to say to yourself is, you are reading somebody's mind and you are not really able to. You don't really know what your friend is thinking. So I would suggest that you be open-minded about what your friend might think. And actually, most people can't wait to help. But also, I would follow on from what Dulmini said, is that perhaps you could also contact the UK, get a bit of advice from them. They may have somebody who could guide you through it. Okay.
Thanks, Khalida. And another question was, what are the pros and cons for you? I don't know if you've had consultations that have been telephone versus Skype. What are the sort of differences? Maybe, you know, are facial expressions important with those consultations? And
well, I think maybe Josh hasn't had a chance, have you, Josh, to have any virtual sessions? Because you said your team hasn't really been in touch with you.
I did go through some of the comments, so thank you, everyone. I'm glad I'm helping in some small way. I appreciate it. I saw another question you might come across later, Rebecca, which is kind of ties into this when I said talking about the difference between public and private sector. So I had a eye test consultation and my standard checkup consultation, both virtual recently. The eye test, I'll be honest, was completely pointless because you can't test eyes over the phone. It's just, how are your eyes? They're great, fine, no changes, cool, we'll see you in 6 months. As for the diabetes consultation, the consultant in charge asked about my blood sugars, how they were doing, and that was it. He didn't ask about how I was dealing with isolation or COVID-19. He didn't ask how I was feeling. He didn't ask like what I was doing to help, like mentally prepare myself. Didn't give me any sort of general advice, life tips to keep myself sane during this trying time. Just asked how the numbers were. See you later, bye. Which I can appreciate is probably everyone's very stretched thin, and everyone knows the NHS is understaffed as it is. But it felt kind of a bit of a wasted exercise.
Thank you, Josh. Dulmini, what's been your experience?
So I mean, if you can do Skype or some sort of a video consultation, that is definitely so much better. And we have done Skype consultations in our clinics for quite some time. And actually, some patients have said to me that they prefer the Skype consultations than coming to the clinic, because what they said was they feel much more relaxed when they're at their home, and they will think about the questions to ask, whereas hospital, they're anxious, they feel, they're not in their normal circumstances, so they're a lot more anxious in hospital. So if we had to choose between a video consultation and just a telephone consultation, of course a video consultation would be better. But as we can see, with IT and the video, there's always these technological problems. So a lot of NHS hospitals are trialing out a new program called Attend Anywhere, which is another video consultation platform. So I think that probably will be the future.
Thank you. And I think the question is a really great one from a going forward point of view. I think there's a lot from a psychotherapy point of view. There are pros and cons, as well as from a diabetes point of view. And I think there needs to be a bit of research on the therapeutic relationship in a virtual setting versus a face-to-face, because there are things you could argue both ways. The virtual creates a distance which may free some people, or it may inhibit some people. So I think it's, my own experience is that it's gone really well where I've known the patient beforehand in face-to-face, so there's a familiarity. But I've also seen people for the first time on the video consultation. That's also gone very well, because I think the society is accepting the new order, as it were. So maybe there's a bit of we're all accepting this. Emma, do you have any questions to read out?
Hello, yes, I do. And thank you everyone for joining us in the chat. We have so much nice interaction there today, and everyone has been really touched by Josh's story. And of course, thank you for all the information you provide to us, Dulmini. So we have a question that Josh read, but we want some more clarification on when he mentioned that the public sector has not reached out to him during this period. Could you elaborate a little bit more on this? Have they given you any sources in advance or to prepare you for the emergency?
As I mentioned briefly earlier, I haven't been given any sort of pre-warning or any advice, just about how I think I've had one text from my GP saying if you need to contact us, please do. It may be a case-by-case, location-by-location area, but for instance, I didn't know I was considered a vulnerable person until my work told me to isolate before a week or two before the full lockdown went into effect. I came in on Monday and my boss said, you shouldn't be here, you need to go home. And I didn't know that I would be classified as a vulnerable person until my boss told me. No one else warned me about that. And as I said, at the moment, it seems to be very much no one seems to be concerned about, as you say, the psychological issues which can come to effect with all this craziness that's going on at the moment.
So can I follow that up, Josh? Since this is a psychology seminar, what emotions has that caused in you?
Well, like many other people, in fact, I say everybody, we all struggle with bouts of anxiety, depression, negative thoughts. Live with, but if being just more alone than usual, you are left to your own thoughts more often. and that negativity can seep in, and it's even more difficult than ever for people to stay positive or upbeat about life when you've got nothing to do. We're social animals, aren't we? We need people to to stay sane. So I felt a lot of sort of anxiety, sort of I wouldn't say loneliness, but you know, sad bouts of sadness, and then sometimes even bouts of kind of guilt, because even though I'm, let's be honest, like from the grand scheme of things, I'm just sitting inside, I can still eat and I can still drink. There are other people I know personally who have already died from COVID-19. Right. And so I really shouldn't be complaining, even though I am, if that makes sense. And I feel guilty for complaining.
Yeah, that is actually a recurrent theme in general, isn't it? If you've got a condition like diabetes, that a lot of people, that's also that reminds me of another theme that often comes up, which is some people either saying it to you or you're saying it to yourself when you can't look after your diabetes. I shouldn't really moan, at least I haven't got cancer, or other people are a lot worse. And I think it's going back to how not to think like that. And your condition is very important to you, and not to compare it with other people and other people's conditions. So thank you for that comment, and I hope that you have found being on this session and your peer support is actually providing some support and relief for you forward. Emma, are there any other questions?
There is one more question about people tending to excessively eat or drink now that they are at home. So how can people deal with this from a psychological point of view, but also from a physical point of view?
Okay, so from a psychology point of view, I guess the question is to think about what are the thoughts and feelings around their decisions about the food that they eat. I always think it's important to think about your behavior and then always try to attach a thought and a feeling. So a thought would be, I'm hungry. And a feeling might be that I'm anxious. So if you can separate those three different aspects of that's linked to the behavior, and actually say, well, if I'm anxious, is eating actually the right solution? You know, I'm not, you know, if I'm hungry, is it correct that I'm hungry? It might be that you've already eaten just half an hour ago. So it's about actually challenging, actually acknowledging your thoughts. What are they that are linked to your eating and your feelings? Am I anxious? Am I depressed? Am I fed up? Am I feeling guilty? Am I feeling bad? And then trying to replace them with rational thoughts or more sensible thoughts. And I always think that these are all thoughts and feelings that you have in your mind, and therefore you can actually alter them. You know, you can allow yourself to have a different thought. Often people say it is a thought not to eat that bad food, but it's often just a tiny thought compared to the urge to eat. So what I'm trying to say is that you've actually already got that thought. You just need to sort of emphasize it. I do agree that during COVID-19 and isolation, where you haven't got anybody to balance your feelings, that you're not being distracted by work and by friends and timetable, perhaps think also in terms of your behavior of eating, is there an alternative, like exercise in the house, doing some housework, reading a book, contacting a friend instead. I also think waiting for an hour, just pausing, it's a type of pause. So let me see how I'm feeling in about an hour's time and think of something nice to do in that hour. So these are just very simple things that you can do. But simple, I don't mean simple as in it's really easy. I mean simple in terms of without actually having therapy, something that you can actually think about yourselves. I think we're now just approaching the end of the session. I'd like to hand over to Rebecca to go over this week's toolkit.
Hi, I'll just share the screen with you so you can see the resources. 1 second. All right. Can you see the screen?
Yeah.
Great. So the first one is Dulmini was talking us through the YES program earlier. So if you'd like to find out a bit more information about that, there's a YouTube video. It's only 2 minutes long, and it really nicely shows you what the program is all about. And then the link below is the link to the Guys of St Thomas website, which tells you a little bit more about the program. Another resource, particularly for young people with diabetes, is JDRF. So there's 2 links I've put up on there. One specifically relates to the coronavirus and information specifically for people with type 1 diabetes at this time. And the other link is a link to sick day rules. So that might be something that we want to refresh ourselves on at this time. And the third resource this week is T1 Resources. So they have a Twitter account, but they also have a website, and this has lots of different resources on there for managing diabetes, and also some more recent COVID related resources on there too. So as always, I'll share this on the chat, so don't worry about jotting it down, and I'll share it on our Twitter page as well.
Great. So it's now time is up for our session. I just want to really thank you again, once again, Josh and Dulmini, for taking the time out of your day to join us. And we've really enjoyed listening to you. And I do believe that we've all learned something from you both. So, you know, lots of positives about how we can ask for help, how there are, you can contact your diabetes team, and trying to manage some of these difficult feelings around guilt, around overeating. And thank you very much, Rebecca and Emma, for convening it and looking after us all and reading out the questions. So please do keep sending the questions through the chat function. Do follow us on Twitter at KCLDPsych, which is spelled KCLDPSYCH. I always have to remind myself anyway. And we look forward to meeting you again next Thursday at 12 o'clock. Bye.
Khalida?
Yes?
Do you mind if I say one final thing? Just because it reminded. In regards to the question the audience member asked about the eating and drinking, I know for me anyway, my alcohol consumption has skyrocketed compared to what it used to be. However, it's an important piece of advice I got told the other day, which has really helped me, is that we're all living through the worst pandemic in 100 years. Don't be too hard on yourself.
Yeah.
Everything's terrible at the moment. Please don't be too hard on yourself.
Josh, that's a really lovely, kind, compassionate final message. Thank you. Bye.
Thank you all. Bye now.
Bye.
Bye.
Unknown participant is now exiting.